Whenever the term emphysema came into your exam, the first word that should come in your mind is that of dilation. Yes. As emphysema is a respiratory disorder, so dilation of airways will occur. And if I specify it, then the airways that are distal to terminal bronchioles. So what are the structures which are included here? We have our respiratory bronchiole, alveolar duct, alveoli, the septa here, and this whole structure is known as acinus. If 3 to 5 acinus they come together, then it is known as lobule. So the dilation that occurs in emphysema is permanent. So the emphysema is defined as permanent enlargement of airways that are distal to terminal bronchioles. And how they occurs? So first there is destruction of the wall, and it is not followed by fibrosis. So in emphysema, no fibrosis occurs. So now let's move toward the types of emphysema. The types depends on the location of enlargement within the acinus. So if the proximal or this part is involved, then it is known as Centriacinar emphysema. If the distal part is involved, then it is known as Distal Acinar emphysema. If the whole acinus is involved, then it is known as Panacinar emphysema. And if some irregular areas are involved, then it is known as irregular emphysema. So now let's move towards each of them separately. So first we have Centriacinar emphysema. So this is our acinus, and this part is involved. So we can say that within the same acinus we have an emphysematous part and a normal part, and the most commonly occurs in chronic smokers. And if these are the lungs, so we can say the upper lobes they are involved. Okay, so now let's move toward the second type. We have here our distal acinar emphysema, and these are also known as paraseptal emphysema. Okay, so here this is our acinus and the distal part they are involved. And if I draw the lungs as this, so the areas that are present at the periphery, they are mostly involved. And if I say that these are the septas, connective tissue septa, that are dividing the lungs into lobules, then the alveoli that are adjacent to these septa, they are mostly involved. And if some scar is present here or some fibrous tissue is present here, then the alveoli that are adjacent to these scars or fibrous tissues, they are involved in distal acinar emphysema. Okay, so next move towards our third type, that is Panacinar emphysema. In Panacinar emphysema, if these are the lungs, then the lower lobes they are involved, and they most commonly occurs in patients with alpha-1 antitrypsin deficiency. Okay, and last type, that is irregular emphysema. This is the most common type, and it's mostly asymptomatic. So it is asymptomatic, and in this the areas which are involved they are irregularly present, and this is the most common. But emphysema mostly occurs in smokers, so we have smoking here, and other pollutants also play a role. And a very important component, that is genetic. So there is genetic predisposition that is present, and we will discuss this in detail a little bit later, but let's start discussion from here. So first, as there is damage because of toxic particles that is present in the cigarette smoke and pollutants, and as a result of damage there is inflammation. And if we say that there is inflammation, that obviously there will be inflammatory cells and inflammatory mediators. So what are the cells that are present? We have our macrophages, neutrophils, CD4, CD8 positive cells. And the mediators that are present include interleukin 8, we have our LTB4, we have TNF, and many more. So these mediators, they act as chemokines. They are going to attract other inflammatory cells at the site of the reaction. They are going to act as pro-inflammatory, thus promoting the inflammation, and they are going to act as growth factors. Our next point here is protease and antiprotease imbalance. The inflammatory cells and the epithelial cells, they are going to release the proteases, and these proteases, they are going to cause the breakdown of connective tissue. And here we have smoking that is promoting the macrophages and neutrophils to release reactive oxygen species. Here one a little bit role is played by infections, airway infections. They are not directly involved in the pathogenesis of emphysema, but they play an indirect role in acute exacerbations. And now let's move towards the genetic component. So we already know the whole story that when neutrophils, they are doing their jobs, and as a result of when they are performing their phagocytic functions, the elastase, it is secreted out, and this elastase, it causes the breakdown of elastin protein that is present in the alveolar wall structures, and as a result of the destruction of that elastin protein, the emphysema, it actually occurs. And the patients who have decreased amount of alpha-1 antitrypsin, that actually causes that actually degrades the elastase that is secreted by the neutrophils. And if the patients, they have decreased amount of this alpha-1 antitrypsin protein, then they are more prone towards the emphysema, and it is seen that 80% of these people are symptomatic, and if they are smokers, then the disease that occurs in them is more severe and early in onset. So now let's move towards the morphology. So now let's talk about the morphology. So if I talk about the gross presentation, then in case of Panacinar emphysema, the lungs are paler and they are more voluminous. But in case of Centriacinar, the gross picture is not very impressive, and in the late stages, the lungs are deeper pink and they are less voluminous. And if I talk about the histological picture, then as I have told earlier, there will be destruction of alveolar wall without fibrosis. And if there is this destruction of the alveolar walls, then obviously the pulmonary capillaries, they are going to decrease in number. The most important concept that here I want to explain is that of radial traction. So first, let's discuss the normal lung. In case of the normal lung, this is our parenchyma and these are our airways. Okay, so in case of normal lung, during inspiration, the air easily comes from these air passages. But during expiration, these tissue here, they actually cause radial traction here, and they keep these airways open, the smaller tubes like the bronchioles, the terminal bronchioles. This tissue here, it actually keeps them open. So in case of emphysema, the air comes inside during inspiration, so that's obvious. But during expiration, when this tissue was playing a role in opening of these passages, the radial traction is going to decrease because of the loss of elastic tissue here. So as a result, in expiration, the obstruction of tubes will occur, and as a result, there will be air trapping. So this point is very important, that in emphysema, radial traction decreases because of the loss of elastic tissue in the alveolar walls. So now let's come towards the clinical features here. There will be dyspnea, shortness of breath, and the cough and sputum, like they can be present or they are not. Surely they are present in the patient. Okay, the next point that is important here is that of weight loss, and sometimes it's that much that we can actually that our differential diagnosis can include an occult tumor, and we have this ratio FEV1 over FVC, it actually decreases. Yes, that's very important point here. And as I told earlier, there will be destruction of alveolar wall and as a result there will be decrease in the pulmonary capillaries, and we already know that in case of pulmonary vessels, the hypoxia induces vasoconstriction, so there will be pulmonary hypertension. Pulmonary hypertension can occur in these patients with time, and as a result of pulmonary hypertension, right-sided heart failure can occur. So we have actually two presentation. One are the pink puffers and other are the blue bloaters. So let me explain them. In pink puffers, there is dyspnea. It is actually the first initial symptom that appears in the patient. As a result of dyspnea, the patient hyperventilates. Okay. So as a result of the hyperventilation, the chest become barrel shaped. So barrel shaped chest occur. Next, there is hunched over position. But one thing that is important here is the gaseous exchange. It is normal, and the concentration of carbon dioxide and oxygen in the blood, they are also normal. Okay, but as I told earlier, there will be air trapping, and as a result, there is barrel-shaped chest. And one another feature here is that there is prolonged expiration. Okay, now the blue bloaters, they actually have another component here that includes chronic bronchitic component. So here in these patients, dyspnea is not the first symptom, and mostly these includes cough and wheezing. And here, if the respiratory drive is reduced, then hypercapnia, hypoxemia, and cyanosis, they can occur. So that's all about the emphysema. If you like this video, click on the like button and also subscribe to the channel. Thank you so much for watching this video.